Hello, Dr. Marte. I'm happy to see you today. How are you?
I'm fine, thank you. You?
Oh, very good. Super. So, doctor, let's talk today about liposuction because this is one of the top procedures ever. I have a few questions for you from our customers. So, they are wondering about these things. First of all, who is a good candidate for liposuction?
Any person who has fat deposits on any part of the body without sagging skin or abdominal muscles separated is a good candidate for a liposuction. Fat deposits without sagging skin because of the pregnancies or abdominal muscles separated is a good candidate for a liposuction.
Mm. Okay, so the second question is about the loose skin. Will loose skin on my belly after pregnancies tied back after lipo, or I need a tummy tuck?
It is going to depend on some factors. The laxity of the skin, how many pounds have you gained after pregnancy, if your muscle have separated after pregnancy. Most of the patients suffer a muscle separated after the pregnancy. If this is your case, you are a candidate for a tummy tuck. Okay. You have to keep in mind also the laxity of the skin, and there are the major factors to see if you are a candidate for liposuction or a tummy tuck.
Okay, and what is recovery time on liposuction versus tummy tuck?
If you get only liposuction, 10 days are enough for a time recovery. If you get a tummy tuck, the time will be between 15 to 20 days. It's going to depend on what do you do in your work. Okay, if you lift heavy things, you have to wait until 20 days after the tummy tuck. Okay, if you work like a secretary, a teacher, 15 days are enough.
Okay, because I wanted to ask how soon I can back to normal life or after a liposuction. And what I mean, it's more normal things such as drive a car or work out in the gym.
10 days is the time. Liposuction doesn't require a long recovery time because you don't have incisions, you don't have stitches, you don't have a drain, for example. So the time is 7 to 10 days normally.
Okay, awesome. Doctor, how much weight can I lose?
I always say to my patients that weight loss is not the best way to evaluate the results of a tummy tuck or a liposuction, for example. The best way is the size of your clothes. Okay, you're gonna see that you're gonna use smaller clothes, smaller pants, smaller skirts. That's the best way to evaluate your results, not the weight factor.
Okay. Okay, doctor. And after I will go back to smaller skirt, smaller pants, will fat return? Can it return?
Yes. Yes. If you don't, after any kind of plastic surgery, you have to eat healthy. You have to exercise, because if you continue doing what you were doing before the surgery, you're gonna gain weight again. Okay, simple.
Okay, so surgery resolves some problem, but then it's up to me to maintain the result.
Yes, you have to eat healthy. You can eat whatever you want, but smaller. Fewer.
Yes, doctor, what are do's and don'ts after liposuction?
Okay, immediately after the liposuction, the two most important things are keep walking and drinking water.
Okay.
It's very, very important. I always say to my patients, those two things, the same day of the surgery. 4 or 5 hours after the surgery, I always tell them, walk and drink water. It's the most important.
Okay.
You can walk, you can drink, but those things are the most important.
Okay, and what are don'ts?
Well, you cannot stay on your bed.
Oh.
You can't go out, for example, to take sun.
Mm.
Go close to the heat.
Okay.
And just that. After 7 days, you can do whatever you want.
That sounds good. Doctor, should I do lipo if I'm over 50 years old?
Yes, definitely. Without any problem. If you have some illness, for example, high blood pressure, diabetes, you have to get those under control.
Mm.
If you have all your illness under control, you can get liposuction, or you are 60 or 70 or 65 years old.
Okay, thank you. And often our customers, patients, they say, I want lipo, I want to go through a surgery, but I feel anxious of having it. How to calm down my nerves?
Just trust your surgeon. Trust your surgeon is very, very important, and never lie to him.
Never lie to the surgeon.
Never. You have to be honest with your surgeon. You have to tell him if you are taking some medicine, if you are suffer from some illness. Never lie to your surgeon. After that, trusting him is the best way to you be calm.
Are there any side effects of liposuction?
Yes, the two most important are bleeding and the blood clots.
Oh.
Yeah. To prevent bleeding, you have to go to the surgery room with a good hemo, 12 at least. Okay? And to prevent blood clots, your surgery will use blood thinner and compression socks. And that's why I told you before that walking is very, very important. Walking is one of the best way to prevent blood clots. Okay?
Okay. Yes, doctor. And what are benefits of having this procedure?
Okay. In my opinion, the self-esteem is the best benefit. It is very, very good when you see your patients happy after the surgery with a new shape, with a new body.
Yes. Okay, doctor, thank you very much. It was very insightful.
Thank you. It was a pleasure talking to you.